Governor Gavin Newsom was in San Diego Friday to tour 211 San Diego and highlight California's lead in the fight to make health care more affordable for residents.
No state in the country is doing what California is doing on health care. That expansion in the middle class is a big deal. It's interesting how much attention, I get it, and it's understandable, that was given to the expansion of health care regardless of your immigration status. But it was equally remarkable is how little attention was given to the expansion of our subsidies into the middle class. $172 a month of subsidies for families of four earning up to $150,000, for an individual earning up to $72,000. Those subsidies are now in place. Those are folks earning up to what we refer to in the language of politics, 600% of federal poverty. No state has gone that deep into the subsidy expansion. No state has gone deeper into expanding for people earning 200 to 400% as well. And that was another commitment that was advanced in this budget. $2.1 billion. That was the expansion when you get the matching federal funds in increasing our Medi-Cal reimbursement rate, which has traditionally been one of the lowest in the nation. We're now making progress to get out of the bottom and to move more appropriately to encourage more of our primary caregivers to provide that quality access.
Millions of families rely on Covered California for their health care. California embraced the Affordable Care Act from the very first moment because we knew that health care was a critical need and a priority issue for our families and our citizens. That's why this year our final budget, as my assembly member said, invested more than $450 million in increased premium support for middle class and lower income Californians. We heard you and we responded.
The significant expansion and access to quality health care through this year's state budget for some of the most vulnerable populations in California. This includes $98 million to expand full-scope Medi-Cal coverage to eligible young adults ages 19 through 25, regardless of their immigration status, starting on January 1st, 2020. That means that 90,000 additional Californians, our neighbors, our schoolmates, our family members, will now be receiving full-scope coverage under the Medi-Cal program because of this exceptional public investment.